our somatic practice today is called, it's got a few different names, nerve flossing, okay, or neural gliding. And basically, it's a nerve mobilization. So we're going to affect the nerve, but we don't stretch nerves. But we're going to work with the gliding fascia that the nerves run along. And when we work with the fascia, it has um, I'm going to say an effect on the nerves where if you have inflammation and pain from the inflammation, it can actually help relieve that. Okay. For this one, I teach this in yoga classes and we don't use a chair. We do it on all fours. But it was traditionally created and it's really more physiotherapist. So if you go to pain management, it's one of the little tools they may teach you. This one's going to work really well with back pain, but it can also help with sciatic. Okay. So you do need a chair and, preferably a sturdy chair, like a dining room chair would probably be fine. I just have one of these fold up chairs. Okay, I'm going to put myself just on a slight angle so it might help you just be able to see what I'm doing as I guide you through this. So you're finding a comfortable seat, and you might not necessarily be all the way back unless my feet don't quite come to the ground. So you might want to just come out forward a little bit so your feet are very grounded and comfortable here in this position. Your arms, you don't need them right away, but at some point when we put the pieces together, um, you can hold the sides of the chair with your hand if you like. But let's actually start with the neck. So we're going to move the neck in two directions, and I want you to be careful with your neck. And again, this can help with pain anywhere along the spine. So it could also include the neck, but you're going to just slightly tilt it back without overdoing it. So you're lifting your chin up, and then you're going to go ahead and drop your chin down. And just feel that. Do that a few times very slowly. Inhaling up, we can bring the breath with it. Exhaling down. Okay, and as long as none of this is causing pain, then just continue to do it. Now, if any of this causes pain, the rule of thumb is if you come to yoga with pain, then cause no more pain than you already have. So you might lessen it. Like for some, it might just be very slight. Good. And after your next exhale, let's come back to a neutral, just noticing. Okay, next we're going to work with the legs. We'll do one leg at a time. Doesn't matter which one you start with. And this is where holding the chair, I find, is helpful. You just get a little bit of a brace or a gripping. And it's a gentle gripping. And you're going to take one leg and straighten the leg. And again, you decide how much. You could flex the toes a little bit. Oh, can you feel that? Oh, the back of the leg. Okay. And then lower down. So some discomfort's fine. It might even be expected. Yet don't overdo it. So, don't go to a place where your leg is screaming at you. Just some sensation is good, and lower down. Now, this is going to be really important. Just do it another one or two times. Is that your spine always stays upright when you're making these movements. Okay. And then one more time. Okay. And this time, as you lower the leg, you could slide the foot under the chair if it lets you. Now I have a bar right here and my heel hits it. But if you don't, you could slide your foot further back and then that would be your full movement. So you could just try that on and see if you like that or if it's workable. Okay. We'll do the other leg just to balance it out. So again, lifting first, flexing, lowering down to the floor. Inhale as you lift, and exhale as you lower. Now, as you're doing this side, there might be a difference, right? So notice if you feel a difference. I've been having some issues in this hip. So I can feel it a little bit. Okay, but again, you might just do a little bit less. Maybe you don't lift as high. And then for the last few, you could even try that tucking and see how that feels or how far, or even if you want to add that piece. That's going to be up to you. Good. Okay, great. And then just come to a relaxed place and take a deep breath and maybe sigh the breath out. Just let it go. Okay, nice. We're going to put the pieces together. Again, this is where I think it's very helpful to hold the sides of the chair, if that's possible. I mean, if your chair has arms and around, I don't know, you can find a different way to hold, but if there's no arms like mine, I just like to hold kind of the seat of the chair. And so important to try to keep now your spine in an upright position in what we call neutral. Your spine is not straight, it has curves. And those natural curves are what we call neutral. And then we're going to add the head movement with the leg. We'll do one leg at a time to start. So when you lift the leg, maybe a little flex in the toes, you tilt the head back. Just have a moment to feel that in your back, in your body. Inhale. And now exhale, lower your head, chin to chest, and foot on the floor. But again, if you're tucking, do the tuck. And that's the movement. So continue. This is called pandiculation. Inhale, slowly exhale, and continue to move. Right? And again, you're not moving your spine around. You're trying to keep your spine steady but relaxed. As relaxed as you can be in this upright pose. Move with your breath. Good. And maybe one more time. And then relax. Just take a minute to integrate the first side. Take a breath, sigh it out. Relax here and now. All right, we'll do the other side. You can hold the chair again. Lift the opposite leg, tilt the head back, inhale. And then exhale as you lower chin to chest, foot on the floor or tucking back behind you. And continue to move slowly. Let your breath guide the flow. Sometimes it's nice to actually breathe in through your nose, a deeper, slower breath, but breathe out maybe through the mouth, like you're just blowing the breath out. Remember to try and keep the spine upright. And maybe do one or two more rounds. Good. And then come to the relaxed place again. Relax. Your hands on your lap. Take a pause. Ooh, just notice how you feel. Just see what you're noticing. Feel the sensations. Take a breath in, sigh it out. Okay, beautiful. Now, if you like, we're going to do it with both legs. Okay. If you don't want to do both legs, if it doesn't work out for you, do alternating legs. Okay. So last round, sitting upright, begin, lift both legs, maybe flex toes, tilt head back. Exhale, both legs down, maybe tuck legs as you tuck chin to chest. And continue the flow. And again, if it doesn't feel okay to do both legs, just alternate the legs. First do one side, one leg, and then do the other side. You might feel you're working a little bit of your core here as well. Try and keep the spine neutral and steady. You can stop anytime. Just let your body guide you what it needs. If it needs to take a pause. If you're still going, maybe finish one or two more cycles. Good. And then find the resting place and the pause. And just noticing and feeling, taking a deep breath and sighing out. Just giving your body a moment to integrate, to receive this information. Okay, lovely.